Welcome back and thanks for staying with us. The Democratic, Municipal and Allied Workers Union of South Africa in the Eastern Cape says clinics should be placed under control of municipalities. It says the provincial health department is unable to manage clinics in Zwide, KwaZakhele and Motherwell during the COVID-19 pandemics. DEMAWUSA has also slammed the provincial health department's botched delivery of personal protective equipment and for allowing cases of COVID-19 at clinics to spiral out of control. It further says the department must take responsibility for the deaths of several nurses due to COVID-19. We're now joined on the line by DEMAWUSA provincial co-ordinator Siphiwo Ndunyana. Mr. Ndunyana, thank you so much for making the time this morning. Why are you calling for clinics to be under the municipalities?
Thank you for giving us this opportunity, and I'm greeting your viewers. There are several reasons that we want the municipality to take back the clinics. One of them, which is the most fundamental, is that the clinics, when they were run by the municipalities, they were better run than under the provincial government, because there were a number of things that were provided by the municipality over and above the budget that is provided by the province. And even now, at this difficult time of COVID, the province is unable to provide the clinics with the sufficient medication, the PPEs, and various other things that are basic to the community.
How are things functioning now? Are the structures or the buildings maintained?
Come again?
How are things running as we speak in terms of the provincial government's response to COVID-19 in relation to your space, which is labour issues?
In relation to labour issues? The provincial government has dismally failed the workers in particular, as I've just indicated, in the form of exposing them to the COVID-19, not providing the PPEs, and so on and so forth. So the provincial government is unable to meet the demand of the workers at this critical time. They are not even providing the danger allowance for exposing these frontline workers to this pandemic of COVID.
We've just listened to the Premier of the Eastern Cape, Oscar Mabuyane, saying that since the 100 days of lockdown, they've had better and better insights in terms of how to respond to COVID-19, and they are learning from these insights. But you say the administration of the clinics is far poorer than what is expected. How are you working with government to ensure that, to strengthen these responses?
You see, the provincial government, including Mabuyane and the teams that they have hired, led by Dr. Pillay, they continue to mislead the community. Because last week, Dr. Pillay indicated that they have dropped the level of infection and increased the people that are coming out of COVID, which is not true. We've got statistics that shows the otherwise, including the Premier himself. It's not true that they are dealing with this problem in the manner in which they are supposed to be dealing with. So that is not true.
COVID-19 is a big problem nationally and internationally, and the President has said that all hands on deck. What role are you playing in this fight?
You see, we have been writing as SABC. DEMAWUSA is under the Federation of SABC. We have been writing to the Premier of the Eastern Cape several letters wanting to get involved, wanting to assist in the process with some of the ways in which we can combat this pandemic. Instead, we are being shut down. We are being left out. They are not giving us the opportunity to assist in the process. So we will be able, if that could be conveyed even to them, that we are willing to be assisted, because this is affecting our brothers and sisters, our mothers, our children. Therefore, we cannot be spectators in something that is killing our people.
So again, going back to that address by Premier Mabuyane, where he was launching what he calls a community response plan, encouraging wards to get more active in terms of local responses to COVID-19. What do you think of this plan and how it can be connected to local clinics?
You see, I'm not sure how are they operating, because I'm not sure which community are they talking about, because even at the level of the community is not involved in the processes of this COVID and how to be assisting in combating it. It is a closed matter. We don't know why is it so closed. Why are they running with this project of wanting to assist or combat this pandemic? Probably there are a number of reasons. Maybe one of them is corruption. But if these processes could be transparent, maybe they're going to be able to do whatever they would want to do.
All right, give us a sense of what DEMAWUSA would like to see happening at the clinics in terms of the response to COVID-19, but generally going forward as well, as you say that local clinics must be taken over by municipalities.
We would want to see the clinics being properly equipped, being fully staffed, because currently the clinics are short-staffed. There is no enough material, and there is not enough protective clothing for staff. So therefore, we would want those things to improve, and even the manner in which the community is being attended to. Because we cannot have long queues of people that are coming to the clinics. At least better management of people that are attending to clinics, some kind of awareness to community as to how they must be regulated in terms of coming to clinics and so on and so forth.
All right, we thank you so much for talking to us today, but also want to ask you, what's the way forward? How have you sent out your demands to government? When do you hope to get responses in terms of finalizing this call?
We, as I've indicated, we have wrote some letters to government. We are introducing this matter to the different municipalities, in particular the metropolitan municipalities, which we think they have more potential of running this service. However, we are going to be joining with the community. We will be joining with the other progressive formations in fighting this. We are not going to leave this unattended, even if it means there must be kind of campaign that was taken in making sure that this service is better run.
Let's thank you again for your time.
Thank you again to you also.
DEMAWUSA Provincial Co-ordinator Siphiwo Ndunyana.